Bob, I'm Jorie. I'm going to be your nurse today. I'm going to start out by providing privacy and washing my hands. Can I have you verify your name and date of birth? He says Bob Owens, 9/22/33. This matches with his wristband as well as my MAR. Are you allergic to anything? He states morphine, which is what it says on the MAR here. Okay, so today what we're going to be doing is giving you some hydromorphone because I heard you have some pain going on. So the doctor ordered that to be given through your PICC line. Have you ever had any medication through this line before? He says that he has, so he is familiar with this procedure and is able to follow directions appropriately. I'd want to make sure to check why he has a central line and what it is being used for, as well as if the agency that I am working for calls for a heparin flush, I'd want to do that. I made sure to check the expiration date of all of my flushes, and they are good to go. So now what I'm going to be doing is checking my hydromorphone with my chart here. So it's hydromorphone 2 milligrams per 1 milliliter, and the expiration date is 12/20/30, so it's good to be used. And we have hydromorphone 1 milligram IV push every 3 hours as needed for pain, and we're giving it to Bob Owens, due now. It matches with my hydromorphone 2 milligrams 1 milliliter. And I did my math already, showing that I'm going to be drawing up 0.5 milliliters. And I would want to check the compatibility with my Betty book here, in case he did have anything, any other solutions infusing, which he does not. But I check anyway, and I do see that it is good to give this dose, and I'm going to be running it over 2 minutes. Okay, so now that that is all checked, I'm going to prepare my medication. Swab off the top here. Okay. And now attach this. Okay. So I'm going to draw back 0.5 here, making sure that there's no air bubbles. Okay, so I have my 0.5 ready to use here. Oh, sorry, I've got to show it one more time here.
It's blurry. There we go.
It's a little blurry. Want to hit the lights over there? I don't know if we can or not.
Yeah.
The lights are shutting off on us. There we go. Okay, let's just show it one more time here. Good? Okay, so now I'm going to be comparing it with my chart for the 5 rights 3 times. So I have my hydromorphone. It's 2 milligrams per 1 milliliter. I'm giving 0.5 milliliters. IV push every 3 hours as needed for pain, and I'm giving it for Bob Owens, due now. I have my hydromorphone 2 milligrams per 1 milliliter. I'm giving 1 milligram, which is 0.5 milliliters. IV push every 3 hours as needed for pain for Bob Owens, due now. I have my hydromorphone 2 milligrams per 1 milliliter. I'm giving 1 milligram, which is 0.5 milliliters. IV push every 3 hours as needed for pain, due now for Bob Owens. Okay, so now that I've got my checks all done, and I pull back a little bit on this syringe here so I can add my medication to dilute it. Okay, get rid of that appropriately. Sure I get all the air bubbles out here. Okay, and I want to make sure to label this one with a piece of tape so I do not get it mixed up with my flushes. Ooh. down and get my other flushes ready here. Make sure there's no air bubbles. Okay. So now that those are all set, I'm going to wash my hands one more time here. And I'm going to apply some gloves. Okay, and before administering the first flush, I would want to assess the site where the central line is and be sure that there's no signs of infiltration or infection, and the site does look good and I'm able to use it, which is great. So now I'm going to swab off the top here. That. I want to unclamp it. Okay. Hold it here and get my flush ready. And this is just the 10 milliliter pre-flush I'm giving for you, Bob. Making sure he's comfortable. It's going in okay. Okay, while that's in, I want to re-clamp it. Okay, get rid of that. Now I'm going to swab it again for about 15 to 30 seconds, or as your agency calls for. And I'm going to be giving my medication now. No air bubbles. To unclamp it here. And as I am giving this, I want to make sure that I am assessing for any adverse reactions, as well as giving it over the full 2 minutes. So I got my watch on here. I can watch and make sure that I'm giving this slowly over the 2 minutes. And for the sake of time, we're just going to say that it has been the 2 minutes. There's no adverse reactions occurring. So we're going to clamp it. Get rid of that. Okay, Bob, we're almost done here. We got one more flush. Swab it off one more time here. Sure there's no air bubbles. Unclamp it. And for this last flush, I'm going to, for the first 30 seconds, give it at the same rate as the medication, so I'll be sure to watch my clock, as well as, because it is the PICC line, I'm going to be using the pulsing technique. Okay, we'll say that those first 30 seconds are up, and the full flush is given, and I'm going to re-clamp. Okay. Okay, so now that that is all done, I would make sure to dispose of all of my supplies appropriately, such as in the sharps container, and make sure that Bob is comfortable. He has his call light. If he has any questions, he says that he is good for now, and he will call if he needs help. I would make sure to take off my gloves and wash my hands, and I would want to modify this procedure across the lifespan if I was working with a pediatric or elderly client, and as well as documentation of the time, the date, any assessment findings, and how he tolerated the medication.